Hello everyone, welcome to my another video. Today we discuss about a special MCQ for upcoming NORCET 2023. This is part 6. For more important MCQ on nursing subjects, make sure you subscribe to this channel. Question number 51. Which of the following factor is most likely contributes to the increased incidence of hip fractures in older adults? Option A, carelessness. B, fragility of bone. C, sedentary existence. D, rheumatoid diseases. Right answer is option B, fragility of bone. Bones becomes more fragile because of loss of bone density associated with the aging process. This often is associated with lower circulating levels of estrogens or testosterone. Next question. A nurse is assessing the leg of a client with a history of chronic venous insufficiency. What physiologic changes should the nurse conclude is the result of this disease process? Option A, necrotic tissue. B, ecchymotic areas. C, diminished pulses. D, brown discoloration. Right answer is option D, brown discoloration. The release of iron from hemoglobin as erythrocytes disintegrate in tissue that results in ferrous sulfide formation, causing darkening of the tissues. Next question. What nursing action will limit hypoxia when suctioning a client's airway? Option A, apply suction only after catheter is inserted. B, limit suctioning with catheter to half a minute. C, lubricate the catheter with saline before insertion. D, use a sterile suction catheter for each suctioning episode. Right answer is option A, apply suction only after catheter is inserted. The negative pressure from suctioning removes oxygen as well as secretions. Suction should be applied only after the catheter is inserted and is being withdrawn. Next question. A nurse repositions a client who is diagnosed with emphysema to facilitate breathing. Which position facilitates maximum air exchange? Option A, supine. B, orthopnic. C, low Fowler. D, semi-Fowler. Right answer is option B, orthopnic. The orthopnic position is a sitting position that permits maximum lung expansion for gaseous exchange. It also enables the client to press the lower chest or abdomen against the overbed table, which increases pressure on the diaphragm to help with exhalation, reducing residual volume. Supine position does not permit the diaphragm to descend by gravity, and pressure of the abdominal organs against the diaphragm limits its movement. Low Fowler and semi-Fowler position does not maximize lung expansion to the same degree as the orthopnic position. Next question. During administration of an enema, a client reports having intestinal cramps. What should the nurse do? Option A, discontinue the procedure. B, instill the fluid at a slower rate. C. Lower the height of the container. D. Stop the fluid until the cramps subside. Right answer is option D. Stop the fluid until the cramps subside. Administration of additional fluid when a client reports experiencing abdominal cramps adds to discomfort because of additional pressure. By clamping the tubing a few minutes, the nurse allows the cramps to subside and the enema can be continued. Cramps are not a reason to discontinue the enema entirely. Temporary clamping of the tubing usually relieves the cramps and the procedure can be continued. Slowing the rate decreases pressure but does not reduce it entirely. If we lower the height of the container, this will reduce the flow of the solution, which will decrease pressure but not reduce it entirely. Next question. Which clinical manifestation will increase in a client with Cushing syndrome? Option A. Urine output. B. Glucose level. C. Serum potassium. D. Immune response. Right answer is option B. Glucose level. As a result of increased cortisol levels, glucose metabolism is altered, which may contribute to an increase in blood glucose levels. Increased mineralocorticoids will decrease urine output. Sodium is retained by the kidneys, but potassium is excreted and the immune response is suppressed in Cushing syndrome. Next question. A nurse is caring for a client who is admitted to the hospital with the diagnosis of primary hyperparathyroidism. Which action should be included in this client's plan of care? Option A. Ensuring a large fluid intake. B. Providing a high calcium diet. C. Instituting seizure precautions. D. Encouraging complete bed rest. Right answer is option A. Ensuring a large fluid intake. Fluids help to prevent the formation of renal calculi associated with high levels of serum calcium. Additional calcium intake may increase the already high levels of serum calcium. Seizures are associated with low, not high levels of serum calcium. Bed rest is contraindicated because it accelerates bone destruction. Next question. A nurse is caring for a client with scabies. Which information about scabies should the nurse consider when planning care for this client? Option A. Highly contagious. B. Caused by a fungus. C. Chronic with exacerbations. D. Associated with other allergies. Right answer is option A. Highly contagious. Scabies is caused by the itch mite Sarcoptes scabies, the female of which burrows under the skin to deposit eggs. It is intensely pruritic and is transmitted by direct contact or in a limited way by soiled sheets or undergarments. Scabies is an acute infestation. It is a disease unrelated to allergies. Next question. A nurse places a client with severe burns on a circulating airbed. What is the primary reason why the nurse implement this action? Option A, increase mobility. B, prevent contractures. C, limit orthostatic hypotension. Option D, prevent pressure on peripheral blood vessels. Right answer is D, prevent pressure on peripheral blood vessels. The circulating air bed disperses body weight over a large surface, which reduces pressure against the capillary beds, allowing for tissue perfusion. These beds are used for clients who are immobile. They do not increase mobility. Next question. In which position should the nurse initially place a client who has experienced a brain attack? Option A, prone. B, lateral. C, supine. D, Trendelenburg. Right answer is option B, lateral. Absence of gag reflex is common after a brain attack. To prevent aspiration, the client is positioned on the side to allow gravity to drain the mucus in the nasopharyngeal area away from the trachea. Chest expansion is hindered in the prone position. Supine position allows the tongue to occlude the airway and encourages the aspiration of secretions if the gag reflex is not intact. Trendelenburg position interferes with respiration and leads to increased intracranial pressure. So this is the today's video. Thank you so much for watching my video.